Next Generation Global Consortium. It's really a pleasure to be here, and we've really been enjoying working with the AFROHUN Secretariat over the last year and are super excited to see this virtual community of practice launching today, focused on e-learning. I'm a professor of medicine at the University of New Mexico School of Medicine and also an associate director at Project ECHO, which is a workforce development and training initiative that started at the University of New Mexico 20 years ago. I'm just going to give a 5-minute overview of what the ECHO Virtual Community of Practice approach is and a little bit of the history in Africa and with the One Health University Network. So you're seeing a screenshot of the first ECHO that started in Africa and Namibia. It was an HIV clinical community of practice. It started 5 years, almost 6 years ago, and has been running every week for the past 5+ years with colleagues across Namibia coming together, doctors, nurses, pharmacists, to learn together through a case-based learning approach to improve the quality, implementing almost 1,000 different ECHO communities of practice in over 45 countries. A year ago, the global consortium of universities that are part of the One Health University Next Generation Network came together within a month of the announcement of the global COVID-19 pandemic and launched in collaboration with AFROHUN and COHUN a series of webinars to share up-to-date knowledge on COVID-19. There were over 1,000, almost 1,000 individuals from 54 countries participated in the first session. There were 14 sessions, 7 for AFROHUN, 7 for COHUN. Colleagues from across the world joined to learn together in a real-time way about COVID-19. And then just a few weeks ago, as I said, the AFROHUN Kenya team launched their AMR ECHO on July 14th. So really, this is about moving knowledge and experience across countries and across continents so we can learn together. And with that, thank you. And I wish you all well with your community of practice focused on e-learning.
Thank you. Thank you very much, Dr. Bruce, for ably taking us through the ECHO. At this point, allow me to invite Dr. Richard, who should be taking
underserved people and animals in the One Health context all over the world. This is the ECHO Virtual Community of Practice model. It's a very simple 4-component model that uses technology, video conferencing, to connect people across countries and continents in the world. We're joining from all around the world today to really empower the agency of local experts and practitioners to share their knowledge and expertise. It's a case-based learning methodology, as you'll see today, where participants will share real cases related to their personal, real experience, and they'll be asking questions and seeking input from the community of practice to find solutions to the challenges that they're facing. So it's an all teach, all learn approach where everyone will be contributing. There will be a brief didactic by a subject matter expert who will share some best practices to reinforce evidence-based knowledge. And then there'll be an element of monitoring and evaluation, the 4th component. And as Winnie said, there'll be a survey at the end of today's session, a brief 10-question or so survey to get your feedback that the program planners will use to improve the quality of this AFROHUN e-learning community of practice so that there'll be a continuous quality improvement element to this learning approach. It's a great opportunity to build bridges across ministries of health, ministries of agriculture, academic medical and veterinary medical centers, the public sector, the private sector, You can invite anyone you want to participate in your learning community. It's a great opportunity to promote interprofessional education, to invite doctors, veterinarians, nurses, epidemiologists, laboratorians, community health workers, everyone who's part of the issue that's being discussed. This is just a visualization of how we hope the knowledge and experience will flow in your community of practice. It will flow in all directions. This really is an all teach, all learn approach. Everyone participating today is considered to be bringing knowledge and experience to the community, and hopefully everyone's coming ready to learn from their colleagues. People often ask, how is this approach different from a webinar? The main difference to me is...
Thank you.
Thank you once again, Christine, for this. Yeah, so colleagues, now we've come to a segment where we're going to listen to our case study and also have a subject matter expert present. But before we delve into the case, I would like to introduce our case study presenter, Dr. Harriet Najimba from Makerere University. She's a lecturer in the Institute of Open, Distance and eLearning. Dr. Najimba, could you say hello to the colleagues?
Yes, thank you so much, Richard. Colleagues, I would like to thank you for coming, and I'm happy to be here. I know we are going to be sharing a lot, so thank you so much.
Thank you. Again, we have our subject matter expert, Professor Paul Dabirev, who is a professor of e-learning, is the deputy principal of the College of Education and External Studies, very experienced in the field of e-learning. He's also a member of the Institute of Open, Distance and e-Learning of Makerere University. Quite a lot of experience in both practice and research in e-learning. So, Professor Muyinda, could you please say hello to the colleagues?
So, colleagues, I'm very glad to be here. I'm very glad to join this community of practice, and I look forward to sharing with you about the topic of discussion today. Thank you.
Thank you, Prof. Muyinda. So, Christine, could we now go straight to the case study?
Yes, Richard, go ahead.
Yeah, thank you so much. So, let me take this opportunity to hand over to Dr. Harriet Najimba to present our case for the day. And after she'll present for, say, for 10 minutes, then we shall have a short discussion, after which the subject matter expert will come in. So over to you, Harriet.
All right, Richard, thank you so much. And colleagues, welcome once again. As I've been introduced, I'm Harriet Najimba from Makerere University, and I'm here to present a case study about modes of learning. Next slide, please. So as educators in sub-Saharan Africa, we are having challenges, and we said, which better way than to come to this community of practice to, to find some kind of solution. So this is why we would like to share our challenge with you. So our challenge is that how can we, as educators in sub-Saharan Africa, design inclusive university education that accommodates all learners across gender and overcoming both geographical and infrastructure barriers, and in this current COVID-19 health complications. Remember, these require us to have standard operating procedures. So how can we design this kind of inclusive education? Next slide, please. Okay, so as the slide comes up, I would like to say that in Makerere University, for instance, we have previously made hard copy study materials available to students, and we have blended these with face-to-face sessions in each semester. We have also developed online study materials, and we have uploaded these ones on the learning management system. We have also gone ahead to use WhatsApp and mobile phones to access learners groups and invite them to get login credentials so that they could easily be able to work online. Next slide, please. So going forward, we would like to continue having printed hard copy materials and CDs available for students. And this is especially for those students who are coming from, who are challenged by connectivity in the rural areas. So we'd like to continue having printed hard copy study materials, and we accompany this with CDs. Then we also want to use mobile phones and send learner support information so that we encourage students to work more easily on the learning management system. We also want to have the occasional face-to-face sessions as we used to have in the past, so that these ones help especially in the area of the practical components of the course. But as we have this as our way forward, there are a number of challenges that we need to think through. So what we have to bear in mind is that, of course, the lockdown as a result of COVID-19 has made students go back to their homes. And as we've said, some of these homes are in rural areas. These rural areas have unstable internet and electricity supply. And for most of the international students, also as a result of the closure, most returned to their respective countries. And some of these countries are still also in lockdown. And then the other scenario we have is that some learners do not have smartphones, let alone laptops. And in instances where a learner has a smartphone or a laptop and stable internet, sometimes such learners may not always have the resources to access data and money used for buying data and so on. The other issue is that although the university staggered students coming for the occasional face-to-face, we continue to have crowds coming, especially for courses that have many students. And yet, the venues we have at the university, not all of them are really that spacious to allow us have effective implementation of the recommended social distancing practices. Next slide. So now the big question we have, and that we would like the community here to help us with, do we have modes of learning that enable continued learning amidst a crisis? So this is the major question we have, and that is what we are grappling with. And we know that this community of practice will help us get some solutions. So thank you. Over to you, Richard.
Okay, thank you so much, Harriet, for that case. So that is the question that we have. Given all those many challenges and of course opportunities that may come indirectly without us seeing amidst the COVID-19 pandemic, how can learning continue? And I think we shall combine the question and answer session after the subject matter expert has also come in to try and give a shot at the case. Then we shall open up this. So let me call upon Professor Mwinda to come in also, make a presentation, then we shall have the general question and answer session.
Yeah, thank you very much, Dr. Harriet, Najimba, and Richard, our moderator, and the colleagues that have joined this community of practice. Indeed, the case that Harriet has given us here raises a number of questions. To all of us, I think now we are witnesses to the fact that the in-person education system has been challenged, is challenged. And within this COVID-19 pandemic, the most hit sector, I think, to me, in my thinking, the most hit sector has been the education sector. And to countries like Uganda, which are still developing, parents are stuck at home with children, especially parents who cannot be able to afford alternative methods of delivery. So our children have been at home since March 2020 because we were not ready as a country for alternative modes of delivery. So what we are used to are the modes of delivery where we have to send our children to the four-wall classroom, brick and mortar infrastructure, so that they can appear in front of teachers and be able to learn in that particular mode, which is the first mode. But now institutions have been closed. And so we have a challenge. We must find solutions. We cannot live like this. We even don't know whether coronavirus or this pandemic is going to end today or tomorrow. And even if it ends, or even if it subsides, isn't there going to be another wave? So to us as a community of practice, I think we need to devise means and methods of living with this pandemic. And those other means, this case study has been hinting on them. The case study was able to hint on methods that are inclusive, especially for our areas where we do have challenges related to electricity, challenges related to internet connectivity. I saw the case study hinting on producing materials, distance education materials. These are materials that could be written especially in an instructive way, materials that could be specially written and they replace the teacher, or they don't replace the teacher, but they kind of subsume the role of the teacher. And these are sent out to students wherever they are, and they can be able to work with these materials and find solutions. So this mode of study actually is one of the forms of distance education, which we normally call the first generation distance education. So I saw that the case is trying to look at first generation distance education. It's also trying to look at multimedia-based approaches, which use CDs, where we can record materials and be able to send them to students. So in that way, we are trying to avert or to mitigate the challenge of connectivity, and then also the challenge of access devices, because many people would wish to access the learning materials using laptops or using desktop computers, but these are also not there. In Africa and in Uganda, you would find that less than 10% of the population has desktop computers or have laptop computers. But again, the good thing is that the majority of our people, especially learners, maybe in higher education institutions, the majority of them have smartphones. At Makerere University, for instance, over 90% of the students have smartphones. And so the case is saying, yes, can't we be able to get learning onto these mobile devices? The case is also trying to tell us that, yes, okay, if you have produced the materials, you have sent them to the learners, you have put solutions on mobile phones and so on. But what about feedback, giving feedback support, supporting the learners? Because learning in distance learning will be so isolated. With the learners will be alone, but they will want to get a feel of other colleagues. They would want to be supported. So I see in this case, learner support coming in so handy, and ensuring that also students are working together, because with mobile devices, we do have applications like the WhatsApp, where we can be able, these students can be able to create WhatsApp groups and also create their own communities of practice, of communities of learning, where they can be able to learn, but they are learning through these resource-constrained environments. And also we are seeing the case talking about blended learning, or talking about issues of mixing technologies, mixing approaches, fusing approaches. So we see you don't have to use only one approach. So it is possible. It's possible that within this pandemic, we can be able to learn, as I can see from the case. And the case, of course, is giving us challenges. Which challenges will always be there. There is no solution. There is no aspect of learning or aspect of implementation which never has challenges. But what the most important thing is for you to be able to conceive, to see the challenges and be able to work around the challenges. You cannot say, I am going to wait for the challenges to phase out before I can be able to take on a particular aspect. So you have to understand the challenges, identify the challenges, and be able to handle each challenge one by one, and then you can be able to surmount and be able to continue. So the case is quite rich in trying to solve, especially issues to do with connectivity and issues to do with access to technology, so that we can be able to now to also move forward to use technology-based learning in the face of this global pandemic. And where technology is not so much available, we can blend it up with a number of other available technologies. We can be able to get the affordances to pick out, to harness the affordances of available technologies to be able to reach out to learners that are stuck at home. So I can see that is what the case is trying to say, and the case is trying to be able to solve challenges of learning within resource-constrained environments, such as ours in Uganda. Thank you very much. Over to you, Richard.
Yeah, thank you so much, Prof, for those comments. Maybe we can take on a few comments from the audience before the subject matter expert eventually comes to give a paper. Please, if you have a matter, you can raise your hand and you speak out, so that we can take on a few comments, just now for about 5 minutes, 5 to 10. You raise your hand so that we can give you a chance to opportunity to speak out. If you want clarity on the case, or you want to provide some solution to the challenge, please do. Let me request our colleague who is putting up the slides, put up the slide of the question, the big question, the main question. Put up that slide, the last slide that had the question. The colleague who is sharing the slides, the last one that had the question. The previous, before this one. The one that had the case study. Yes, thank you. So Mamadou, the hand is up, please. Mamadou, you can unmute and speak out. You can provide some kind of solution, or if you want clarity on the case, it can be clear. Yes, please. Over to you, Mamadou, please.
Hello, everyone.
Hello. Hello.
I will continue in French because
yes, please.
My language. Alors, moi, je voulais surtout revenir sur...
I wanted to come back to her concern regarding this question, because currently in the different universities, it's a big challenge. And it needs a decision to be taken, especially to be able to go up to the learners. For instance, we've all have seen the changes caused by the pandemic. It's a health challenge, and this has really affected us, but we have to advance. So if we come to talk about distance learning, the challenge is most of our students live in rural areas, and in rural areas, for instance, like in our country, currently we are in a rainy season, and there are inactivities, agricultural activities are going on, and there could be a problem with us learners being available. Also in Senegal, we have internet challenges, especially the network, which is always disturbed by the rains and the storms. So this is a big challenge for us, and we are saying for now we don't have solutions, and we really don't have a response to this question. Thank you.
Much for that. As you have pointed out, the challenges that many of the developing countries have, and even the rainy season there. Yeah, I know that Professor Mwenda will have a chance to talk about that brief. So Professor Mwenda, you can note that, you'll have a comment. But again, if there's someone in the audience who has a solution, because you would have the same kind of challenge where you are, but there's a way you have approached it, you're welcome to give it. Landry, I see Landry, your hand is up. Yes, please.
I will also continue in French. Merci beaucoup. En fait, nous, l'école de santé publique, nous...
For us in the public health school, we have a challenge also with distance learning, and the biggest challenge is the coordination. I don't know if it's the same thing elsewhere. And I think that's also a challenge with the rural areas, and it's a big problem. And also the internet connectivity is very poor and it is not active. For instance, last year, when we tried it in the public health schools, we tried the e-learning, and the students are still learning much as we have the challenges, but they are supported by the government. But it's true, we are trying to do evaluation to see how e-learning compared to physical learning. And we don't see a very big difference, but we have realized that most of the learners, they have challenges in following these lectures, online lectures. And the biggest challenge, again, it is always the internet connectivity. We have a platform that we're using for distance learning, and with the organization, we also organized an activity of sharing that involved the different levels. For instance, how we can do online learning and teaching. But there is also a problem of COVID-19 in the challenge. But the biggest challenge we are facing is the situation of rural areas where we have students who are in villages where the internet is poor. So regarding that question that you asked, those are some of the biggest challenges. The biggest challenge to us is the internet connection. But we think the internet connection is the biggest problem, especially for only those who are in rural areas, but not the ones in the urban areas. And it is the biggest challenge. That's what I wanted to emphasize. Thank you.
Thank you so much. Landry, you have also brought in an issue that is within organizations, the learner support, which is also an important factor in access, but also the other environmental factor of distance and wherever learners being in rural areas. Thank you so much. I think we shall take on these two, Tobe and Theoneste, and then we shall listen to what is in the chat. Then I give chance to subject matter expert to speak a little. So, Tobe.
Bonjour tout le monde.
Hi everyone.
Hi.
Can you hear me?
Yes, please.
Oui. Etobe from the Université Catholique. We also had the same challenges regarding the e-learning during this COVID time. We created a platform. We tried to improve the internet to do the lessons. But my question is, in Africa, we're all going to say there's a problem of internet connectivity or connectivity. But why are we insisting on e-learning? And yet, we could maybe do lessons on TV, on radio, or by distance learning, not necessarily online. That's my question. Thank you.
Yeah, thank you so much, Etobe, for that intriguing question. Yes, why do we go into 5th generation when we can go to 2nd generation? Because that's what is suitable for our context. That's the question. Yes, then we shall have Theoneste next, and then we'll go to the charts. Yes, Theoneste, Rutaisire.
Hello.
Yes, hello.
Okay, so thank you so much for giving me this opportunity. Anyway, so the COVID-19 came when we were not prepared. So I'm a teaching staff at University of Rwanda. I'm even e-champion on this e-learning activities. And anyway, the challenge we had, so the COVID-19 came when even at university we were not prepared. A lot of problems, we had a lot of problems. So like the one we had, the biggest challenge we had, it was ICT infrastructures. most of the infrastructures we had were not ready to face that problem of that caused by COVID-19. So even lecturers and even some students were not prepared, to use those e-learning platforms. There are some knowledge or some skills you need to have, especially for teachers, especially the skills concerns material development, to develop materials, even to use those e-learning platforms. Most of us were not prepared. Even multimedia production, we didn't have the knowledge or skills that we think could help us to achieve. But our university have tried in those difficulties, and of course we achieved some success. Like we tried to develop materials, and we uploaded them, even if they are not 100%, because there are some ways you need to develop materials, not just uploading anything you have. Among those achievements I'm talking about, more than 27,000 students have registered on the platform. They even try to learn through the platforms. The big challenge we had, the most challenging one, was to develop some materials that students can even use when they are offline. If they get a few minutes to have access on the platform with a little bundle they have, they can download and use them later. That is just a kind of solution I'm trying to highlight. So thank you so much.
Yeah, thank you so much for that. Yes, we put them in forms that learners can download and use later as one of the approaches that you have used in the University of Rwanda. Thank you so much. Christine, could you just highlight a few issues that have come from the chat before I go back to the subject matter expert?
Thank you, Richard. We have a few comments. I wanted to suggest that we continue to the subject matter expert because of time, and then we can highlight as we move forward.
All right, so you'll highlight them later, right?
Yeah, because we are running out of time. Thank you.
Okay, thank you. So colleagues, let me request the subject matter expert then to, you can go to the next slide. Next slide, please. Next, so I'm going to call the subject matter expert to make his presentation, but as he makes his presentation, he can respond to the matters that have come up, because many of them are related to what I suspect you could be going to talk about. If it's not hinted on, he can hint on it. But over to Professor Dabirev from Accra University. He's also the Deputy Principal of the College of Education and External Studies. He'll take us through a didactic presentation that fits into the whole syllabus of whatever we're going to be doing. And also you provide some solutions based on what colleagues have said. I think, Professor Muyinda, we can do this in about 10 minutes. So that again, we can open up discussion again of your presentation and the case, so that we can have a general wrap up. Over to you, Prof. Muyinda.
Thank you very much, Richard, and the colleagues for the questions that you have asked. Can we go to the next slide? So the question was asked to us by the case study presenter. Are there any modes of delivery that can salvage us in the awkward situation that we are in, a situation where our learners are stuck at home? Are we going to wait? Are we going to have our students sit at home and wait until coronavirus is over or until this pandemic is over? Isn't there going to be another pandemic? So there of course, there are solutions. There is the face-to-face teaching, the agenda we're going to talk about. There's distance education, there is e-learning, there's online delivery, web-based learning, there's mobile learning, there's virtual reality, and there is blended learning, which we can look at. Next slide. Now, face-to-face delivery. Before we maybe before we, I think, Richard, are we going to get to do the survey, the poll?
Yeah, if it's ready, it's just a few minutes. It can take just a minute or two. And I think it was done. Kenneth, if it is ready, you can flash it, the poll. Yes, there it is. There it is.
So we are trying to find out which of these modes you are most familiar with, and one will be the meaning not familiar with, and we shall move along that scale up to 5, where one will say I am very, very familiar with this mode. So you can be able to quickly answer this poll, so we can be able to see the results of the different modes of delivery that we can be able to use, basing on the question that we've been asked. So, which of these modes of delivery are you most familiar with, or less familiar with? So you can be able to quickly do this and submit. So we give ourselves like 20 seconds, because these are very few questions. Just answer them, and then we can be able to see the results. Since I'm not the one actually running this poll, somebody who is running the poll should be able to summarize for us, should be able to generate the results and display here the screen, so that we can be able to see the level of familiarity with the different modes of delivery that we could be able to pick on and adapt as we move through this pandemic. All right, I think you can end the poll so that then you can be able to display the results. Richard?
Yes, thank you so much. Ken, could you end the poll and display the results?
Okay, so you can see that face-to-face is indeed the most familiar method. There's no one who doesn't know about face-to-face. Then distance education, go down. Okay, I can go down actually. Distance education is somewhere there, just in the middle. There is a normal distribution that I can see here, very, very normal distribution. And then e-learning, you could see that most of the people also are familiar with it. And then online learning, you could also see that just a few are not familiar with it, just 5% are not familiar with it. And then mobile learning, you'll see that the majority may not be familiar with it. Virtual reality also, the majority are not familiar with it. Blended learning, you see that there is also a normal distribution there. So, okay, that's good. It's good to learn that there is a mixed kind of group that we are having. There are those that are familiar with most of these concepts, and there are those that may not be familiar with some of the concepts. Okay, next. Now, we all say that face-to-face is quite familiar to us because this has been our darling. We know it because it is the one through which we are educated. It is the one that we've been using to teach others. And it is sometimes called presential education or traditional or internal, or sometimes we call it in-person. And it's the most common pedagogy that we use. And usually it is mainly teacher-centered. And that's why when COVID-19 came, because we could not be together with the teacher, all schools had to be closed. So this particular method is getting doomed because of the pandemic. So next is the distance education. Somebody here raised a point which was very valid and said, but why are we insisting on going e-learning? Why don't we go through the traditional systems where we can be able to use television, we can be able to use the radio and so on, or use materials, print-based materials. Yeah, to be able to separate the learner from the teacher, to be able to separate the learner from the institution that is offering them tuition, so that we can avoid the COVID-19 infection by keeping a social distance as a result of distance learning. So yes, there are many generations that we could use, but most cases, you would find that many universities have jumped onto the 5th generation mode of distance education, which is the multimedia, interactive multimedia online. We have jumped on the 4th generation of distance education, which is the online. And we've skipped the television, we've skipped the 2nd generation, which uses audio, visual, and CDs. But these modes, we can visit them. We can visit them and go back. The 1st generation mode is the correspondence mode, where you can write materials specifically and send them to the students. And you can also send CDs. But the problem is, because we are caught unaware, writing materials for distance learning is not as easy as just getting notes or getting a textbook and you just send it to students. It must be specially written materials, and it also takes a lot of time. So the easiest option that many people have found was if I can get to the computer, I can easily get out and reach to my students. And so that's why many people have run onto the 4th and 5th generation of distance education. Go ahead. Now, e-learning and online learning, these are open and distributed learning environments that utilize pedagogical tools enabled by internet and web-based technologies. And this is where we have gone, because internet is here with us, and we are living in a global world. We are living in a global village. So many people have gadgets. Many people can access internet. So that's why a number of institutions, a number of teachers have adopted to e-learning, or the use of technology to reach out to learners. The use of online systems to reach out to learners, because these are especially when it comes to if you use mobile devices, which have reached out to most of the people in different villages. But of course, there are challenges related to it, as we have seen here, challenges of connectivity, internet connectivity, where somebody said when it rains in Africa, internet actually disappears. But we will need our governments to be able to move with the rest of the world. Move on. Mobile learning, we've talked about it. We have gadgets that are mobile, that allow ubiquitous learning. They allow learning from anywhere. And so we can also use this. There are a number of learning systems that have been created that can be ported on mobile devices, so that we can be able to enable mobile learning. So this can help where there are challenges with connectivity, where there are challenges with the lack of laptops or desktop computers. Move on. Move on. Now, virtual reality, of course, this is more where we are trying to see how we can be able to do practicals or practicums in the online environment. But of course, as we have already said, with our internet challenges, it might be very difficult for us to embrace this for now. But already some countries in Africa are embracing virtual reality, where this is kind of a simulation of a three-dimensional image or environment that can be interacted with in a seemingly real or physical way. The environment is not real, but then it's made real with technology support, with special equipment like a helmet that somebody can put on their head, or gloves that they can put on, and be able to simulate a real environment, but in a virtual way. That is good, especially when you are trying to simulate practicals. Go on. And of course, blended learning. This is where now there is a careful and thoughtful fusion of face-to-face and online learning experiences. It must be careful fusion. It's not just a mix. You don't just have to mix because you are told you have to mix in blended learning. You have to look out for the best from maybe each technology that you want to mix. If you feel that in your settings, computers are not available, then you can say, okay, I can use a mobile phone, but what can I use a mobile phone for? Not everything, not every learning episode can be possible on a mobile phone. But there are also those learning episodes which are very affordable on the mobile phone. So it has to be a careful fusion. You have to sit and think about it, and before you can fuse. But you can fuse methodologies, you can fuse technologies, you can fuse pedagogies, so as you can be able to come out with the best learning experience. Next. And so we can see that we have these different models where we have face-to-face that is supported with online solutions, or you can have face-to-face almost the biggest portion of your work could be face-to-face, but then you use online tutorials to support the face-to-face, or you can have synchronous and asynchronous interactions. Go on. So these are what we mean by what blended learning involves. It involves blending pedagogies, different pedagogies. You can blend the constructivist with the behaviorist approach. You can blend the connectivism with the social constructivism. You can blend methodologies, or you can blend technologies. So blended learning is that careful fusion of all these three. You can be able to choose one, or choose two, or choose three, or choose all of them. Go on. And lastly, of course, blended learning is what most of us in Africa are choosing. At Makerere University, we chose to go blended because we do not have all the technologies that can allow us to wholly go online, because it presents a number of opportunities for collaboration in a distance. It increases flexibility, it increases interaction, it enhances learning by providing different learning activities and improving engagement of learners with their content, learners with their fellow learners, and so on. Learning to be a virtuous citizen is very, very important. Nowadays, gone are the days when you have to keep yourself in your cocoon. You need to have networks all over the world if you are to survive in this competitive world. So through virtual learning, we are able to connect up. Like now, I am able to connect up with so many people here that I've never met before, that had never met me, and we are able to talk. We are able to discuss because of this virtual network and making us virtual citizens. Digital learning skills are becoming essential to be a lifelong learner. It's important that everyone gets the digital literacy, because that is quite important for us to survive in this competitive world. And through blended learning, we can be able to achieve this. Okay, next. So I really want to thank you so much. This has been a presentation which gives us some of the modes that we can adopt and to answer the question that the case presented to us. Which of these modes can we pick on? There are a number of modes. It's not necessarily true that we should just go by the mode which uses online learning, because we may not have the resources, but there are various modes available at our disposal that we can be able to take on. So let's evaluate the different modes that are available at our disposal to keep social distance, to keep ourselves safe, and to keep the quality of learning high, because all those modes can be able to ensure that high quality learning is achieved. Thank you so much, Richard. Maybe if I can be able to talk over some of the questions that were asked, if I still have time, I will be able to talk over them. But if I don't have the time,
Professor Mwinda, thank you so much for that presentation. Yes, it's okay, because we are seeing the question and answer session now, that we are actually in the second question and answer session. So it's okay. You can begin there. Then I can add on another comments that have come in through the chat. You can first comment on what you have already there.
Yes, I have commented already on some issues already which were asked, like electricity, not there being no electricity, then connectivity. If we are to go online, then our countries have to do deliberate investment. Like we do invest in roads. We invest in roads. Our countries invest in roads, building of roads. They must also invest in building the information superhighway, because it is also becoming a human right. Indeed, internet is becoming a human right. So we must, as a countries, must invest in these highways as we invest in the highways or of the roads. Then, of course, we have said blended learning can be able to support us where our internet connectivity could be so sporadic. Then adoption of online learning is not something that you just wake up and adopt in a single go. There must be capacity development. Capacity development for both the teachers and the learners. Many students are going to resent use of online learning. Even many teachers are also going to resent use of online learning because they lack the capacity to be able to implement or to be able to learn through e-learning or through online learning. So it is important that we build the capacity of faculty, we build the capacity of staff, we also build infrastructure capacity in our institution so that we can be able to have online learning or e-learning if we are to adopt that particular strategy. I think that is that.
Okay, thank you so much, Prof. Mwinda. And when you talked about generations, you also reminded me, someone who said that, why do we go with fifth generation? Let's go back to, our correspondence. And I say that there are some contexts in Africa where it is still relevant, actually, to write out physical printed books and send it to our colleagues who may be in places where we cannot have, where internet probably is poor. Let me read some messages from the chat. Professor Matthias Kousi of Cote d'Ivoire says that we need to bring the sub-regional economic community or African Union to help find solutions to reinforce electricity supply and also reduce internet costs. So you're talking about partnering with working with the regional bodies. Sometimes these issues are beyond universities, they are beyond the countries, and we need to work as a region. Another one says that the solutions highlighted, sometimes the solutions that we come up with ignore the huge inequalities between impoverished and privileged students. Many of the solutions posited will widen the already existing differences in quality of education between those groups. Terminologies like access to technology simply obfuscate existing inequalities in societies, and no matter how we spin the situation, many of the students will never be able to attain proper education in a time like this of COVID-19. Access to education doesn't exist in a vacuum. It's shaped by large forces in society. As One Health Network, the solutions need to consider a wider set of actors and not only e-learning teams and IT infrastructure. Yeah, I don't know, it may not be possible to have everybody on board at the same time. I remember when technology was anything that makes work easier. Now, we have national exams, for example, and today primary mathematics examination is a mathematical set. But then we have areas where learners don't even have access to mathematical sets. But is it that we exempt those from national exams, or we have to find solutions for them also to do national exams? We set another set of exams. How do we make all these come on board? Another one says that the problem is not only the connection, but also the electricity or energy. Not all learners are powered in the same way, but they're thanking you that, like Paul said, we cannot wait for challenges to disappear and then work in the absence of the challenges. Despite the internet connectivity problems, we can still try e-learning, for example, intermittency network. We can use a mixture, and that's what blending now, I think, of strategies, e.g., take use of asynchronous technologies for students to log in when their internet allows, and then back with their materials, back this with materials that can be sent to students by mail. And I think that's something with correspondence. All right, so colleagues, do we have anybody wants to add something? Or Professor Mwinda, any comment you have about what has come out of the chat?
I think the colleagues in the chat have just been providing solutions and suggestions to our challenges as Africa. So I just want to thank them for that particular supplement to what I have presented. Thank you.
Okay, all right. So anybody, Etobi, do you want to say something? I see your hand is up. Probably that was something that
Oh, je m'excuse, je crois que je n'ai pas descendu la main tout à l'heure.
Toby?
I'm sorry, I think I did not bring down the hand. I think I forgot the hand up. I'm sorry.
It's okay. Yeah, so colleagues, as we have heard from the case study and subject matter expert, and over a series of these interactions, we shall even venture at one time into trying to design learner-centered materials that help self-paced learning. And indeed, one of the learning outcomes of today's session was for us to be able to, first of all, distinguish the different learning approaches or modes that are available, and also be able to decide on which is probably suitable for our circumstances. Of course, given the environment that we're operating in. If it means blending, yes, let us blend. Let us have material come probably in different forms, and let maybe those who can electronically study electronically, and those whom we can send the physical or the CDs also study that way. Okay, so I thank you, Professor Mwinda, for your eloquent discussion and of the case, and also what you have presented. I thank you, the audience, for the solutions. I thank the case study presenter for eloquently setting the ball rolling. So I think let me hand over to Christine in the program so that she can give us the next way forward. Christine.
Thank you. Thank you very much, Professor Muyinda and Dr. Richard and everyone. I think this has been really, really very rich. And just to assure participants that we've taken note of all the comments and the questions that have been coming in the chat room. And we are going to provide solutions or comments or whatever it takes in a subsequent email that is going to come to each one of you. So as we continue and get towards the end of this discussion, just keep your comments and questions flowing in. So at this point, allow me to, I think, invite Richard and Ken to take us through a survey. And then from here, we should be able to have Dr. Irene or Winnie to take us through the wrap-up.
Thank you so much, Christine. Ken, could you please advise colleagues on how to access the survey?
I've shared the link of the survey in the chat. If you can check the chat.
Okay. Once again, colleagues, if any of us is interested in a certificate after this, we require you to take this survey, but it is also important for us, given the fact that we are going to have subsequent meetings or sessions, please take up that survey. It is very brief. We can give ourselves, I think, 3 to 5 minutes, and then Dr. Irene will come and give us closing remarks, or Winnie, in terms of the next steps. Thank you.
Christine?
Yes, please.
Yeah, probably maybe Winnie can come in because she has that slide which she has to present to as the colleagues are filling in the survey.
Sure, thank you.
Winnie, maybe Winnie, you can unmute if you're trying to speak. Winnie? Hello?
Yes, sir.
We did not hear, you are in mute.
Very sorry about that. Okay, so mine is just to make announcements, and then Christine will invite Dr. Irene to wrap up and close the session officially. You have noticed that with the launch, we have delved into content, and we have had a very interesting discussion and very rich presentations. But as you all know, this is a community of practice, and we need to be close. We need to know each other. We need to interact very actively. And therefore, we have decided that we, in the next session, will ensure that we have time for us to know each other a little better than we have done today. We also have a platform where we shall share experiences. We'll continue with the questions that have been raised, make comments, and have a very useful dialogue, and that is called Slack. So once we have your details, we shall get you onto the platform and ensure that we continue interacting even outside of these formal sessions that we are having. So there are resources that Christine will share in an email reminder, in an email with you. Our next ECHO session will be on Wednesday, a month from now, excuse me, August 25th, same time, from 4 p.m. to 5:30 East African time. We shall, before the session, we shall share the agenda with you, and we shall come up with preliminary topics that will indicate how our ECHO or virtual community of practice is going to run. But these will be only partial topics, because as Dr. Irene mentioned, we are planning to have a survey immediately after getting ethical approval. And from that survey that will be administered to you and other faculty and institutional leads responsible for e-learning, and we'll come up with the topics that are relevant that you would like us to share during our ECHO sessions. Thank you.
Thank you very much, Winnie. And thank you, participants, for taking time for remaining with us up to the very end. Allow me at this point to invite Dr. Irene to take us through the closing session. Dr. Irene, you're very welcome. I had to face the challenge of I would say e-learning. I've had to change laptops, and this doesn't have the virtual background that I had initially, but thank you so much. It's been an exciting session. Professor Muyinda, that was really wonderful. Richard, thank you so much. I think you've tickled us. We, if you'd open up a discussion, I'm sure there would be engagement for the next 1 hour, but we have to respect time. And I'm hoping that we'll continue with this momentum. Kristen has promised to send through an email with some of the comments, but it's been an exciting session. Where I'm sitting in my capacity as someone who engages in AFROHUN programming, but also management and leadership, I was noting a lot. We've not only appreciated the different learning forms, but also we've appreciated the challenges that we face on the African continent as far as e-learning is concerned, and these are enormous. But also there is a ray of hope. As I was reading the chat, there is hope. In Uganda, there is a program, I don't know whether it's still on, which says that I'll translate it to in English, that you're not poor, but it's your head. It's your head. It's your head that is poor. So we have here brains that can put together solutions. I've been chatting to colleagues at work how we are not only struggling at university level, but even primary schools, how kids are tricking us. Some of them are, they submit work which they've not even done. And so
it is a problem that is not only at the university, but we can together come up with solutions. And I'm hoping that at the end of this, I don't know whether the community of practice ends, we'll have to engage Bruce to see whether you can put an end to this. But I'm hoping that as we evolve, we'll be generating solutions that even surpass university challenges, but also to trickle down to primary schools, because now it is a way of life, as we've had. I've enjoyed some terminologies. Everybody's becoming, what citizen? Is it a virtual citizen? You know, it's not only the university community, but even school level, secondary, primary, everybody's becoming a virtual citizen. And I know it's us at the university that are going to generate some of these solutions that are going to bring digital literacy. I also appreciated the need for that. And from AFROHUN's perspective, as we move forward, I was noting some of the need for capacity development, not only for students, but for faculty. And I'm hoping that we'll have a discussion on this as we move forward in programming. What kind of capacity does it need in terms of human resource that we need to develop? And what can we do as AFROHUN? Of course, the issue of also infrastructure capacity, which I know Professor Minda didn't go into detail on this, but I believe it takes different forms: internet infrastructure, gadgets, those computers and phones, and I don't know what else, iPads. So we can, those are some of the things we've noted. And of course, there was a chat, I don't remember the person, but the person was questioning the approach to just engaging e-learning team. Although I had a question for him, like, what is this definition of an e-learning team? The e-learning team and IT and going beyond to engage other stakeholders. I appreciated that comment a lot coming from One Health. I think multi-stakeholder engagement in e-learning is going to be critical as we move forward and as we design these solutions, as we put our heads together to deliberate on these solutions. We need to think outside the box. Let's think beyond the e-learning team. I'll get the name and maybe have him expound on that. But the e-learning team can be also diverse. It can involve other different disciplines. So let's think of multi-stakeholder engagement. Who else can we bring on board? How can we engage the private sector? How can we engage service providers? And what discussions can we have? So from a One Health perspective, what can we do as leaders in One Health to bring together, to facilitate this multi-stakeholder engagement in e-learning? It's been exciting. Thank you so much. We'll have a report to our CEO, Professor Bazeo, and Professor Kabasa, and of course to our partners to see how we can support these processes. You've tickled us, Professor Minda, you've really stimulated us to discuss. I'm praying that this doesn't fizzle in the next 1 month, that we'll return with follow-up discussions on what we've learned today. Thank you so much. I wish you all a pleasant evening. I don't know whether I hand over back to Christine or I close the meeting at this point.
You close the meeting.
Okay, so with that, are you taking a group photo? I don't know how you do it online.
Yes, please, everyone can switch on the camera.
All right, so the meeting is closed, but I'll hand over to Kenneth, our IT at AFROHUN, to see how we can capture. I think he's manipulating it from his side. So thank you so much.
Switch on your cameras, please. Thank you.
Brief describe what if.
Shyiraho kamera. Shyiraho kamera. Kugira bakubone. Hariya screenshot yambwiye karaga. Screenshot yambwiye karaga.
Kandi nagiye muri bya bindi byo kugira.
Akabubiritse.
Okay, thank you, everyone.
Thank you and bye.
Thank you.
Thank you.
Bye-bye.
See you next time. Bye.
Au revoir.
Au revoir.